you guys already started talking about some of the work that you do. So if you could just let us know how you got introduced to community-based health systems and how your group developed. And we can go in the same order.
Awesome. Yeah, well, so I grew up in East Tennessee. I was born and raised in the South, and left for a little while and came back about 8 years ago. And when I came back, I started working in our community as an herbalist, as a community herbalist. And as long as I've been practicing here as an herbalist, I've always incorporated sliding scale into my work. And so from the beginning of my work, in Knoxville, I've always thought of myself as creating, trying to make healthcare accessible in the community. And I've had a desire to do something more collectively for a while, but herbal medicine is something that is still pretty new in lots of parts of the country, or rather it's like old and new. And so not something that a lot of folks are familiar with. And so the Knoxville Community Apothecary started, like I said, basically when lockdown happened in our community in mid-March. We already started experiencing getting cut off from all sorts of supplies, including herbs and things like that. And it became apparent from what we were seeing in other regions of the country that folks were going to have to be treating themselves most likely at home for this virus. And so immediately I started organizing and linking up with other clinical herbalists that I knew around the country, just trying to see what folks were already doing in their communities, what seemed to be working, what kind of information I could get in the hands of our community members so that they could be prepared to make decisions about their health at home, and to be able to treat people as much as possible at home and know when it was time to go to the hospital. And so very rapidly put together a workshop, a free workshop for community members to come to just get some basic like kitchen medicine knowledge around this virus. What do we know right now? What are next steps? And what came out of that workshop that we did was a lot of excitement at how we can start preparing our community better, not just around COVID-19, but how we can actually be creating better access to healthcare for everybody. Specifically houseless folks in our community, specifically poor and working class folks, BIPOC, et cetera. And so a friend of mine who's been doing mutual aid work here for a while, we do have a couple other mutual aid collectives and harm reduction collectives here in Knoxville. We all kind of linked up with the idea of starting an herbal mutual aid project. And that was how the Knoxville Community Apothecary was born. And we started out just kind of like rounding people up, like who were the kitchen witches we already knew in town, who were the medics, who were the herbalists that were already here, and trying to just like get people in the same room. What do we have access to? Like everyone's bought up all the herbs, but we know we've got garlic and we can like access ginger at the grocery store. Like what are the things we can get together? And so we started out just sort of preemptively making herbal remedies for COVID-19, even though it had not really hit our community yet. In April. And so a lot of what we were initially doing in the spring was getting medicine to our houseless community. We already have a lot of amazing organizers within our network who have been working in houseless camps for a while and have those relationships. And so we started out just trying to get direct medicine to folks based on need, wound care, things like that. And then when the uprising started, we pivoted our work to how we could be supporting BIPOC and frontline activists, not only in our community, but around the country. So we started sending medicine like all over. We just free, everything is free. What do you need? You need help sleeping? Like how can we support Black leaders right now in different communities? How can we support other frontline activists in this moment? And so we started shipping stuff all over the country. We've also been sending medicine to a lot of reservations out west too. And so we like met that moment, and then July came for us, and all of a sudden COVID hit our community. So we are very much new to this work and figuring out that question around how to make things sustainable, how to be getting, like bringing more people into this work so that it can continue long term. A lot of like education pieces in our work, because like I said, herbal medicine is new to a lot of folks. And so it can feel weird or scary or confusing And so we're really, really trying to draw on a lot of the traditional and indigenous knowledge within our communities around working with herbs and, teaching folks what they can do at home and how they can make decisions about their own bodies and their families' bodies too. And I think only other thing I'll add too is that we also have been doing a lot of work linking up with small projects like our own around the South. So really trying to build community with other herbalists and healthcare workers of all sorts, medics and activists around our region, so that we can be sending each other herbs and medicines, so that we can be supporting one another and holding one another in the work too. So I'll stop there. Great.
That was so wonderful to hear, by the way, Rachel. I really appreciated that. Hi, everyone. Again, my name is Journey, and I'm from Ujimaa Medics. As you all can probably tell, I'm pretty young. I'm 19, and so I became a part of U Medics when I was 15. So I've been doing this work for kind of a long time, and more importantly, throughout the most impressionable years of my life, as my values and such were still under construction. So through my work through the community and taking initiative and things like that, that's kind of how I've been able to have a better idea of what health autonomy for people of color looks like, especially in urban settings, because like I said, we are based in Chicago. So personally, I became a part of Ujimaa Medics just kind of on a whim. In the household I was raised, we always had a very well-rounded perspective on what health looks like, and not only just liberating Black people and oppressed people of all types of different things, you know what I'm saying? And so we always, in my household, were trying to go to different things and learn different things. So when we went to the Ujimaa Medics orientation, then I was like, this is something I really want to do. So then I built from that, became a member, started training, then started speaking on behalf of U Medics and doing outreach things. And through that experience, I've also become a part of another organization called Sacred Keepers, which is an environmental justice nonprofit also located in Chicago. So saying that to say, my perspective on what health looks like and what community health looks like as a whole has been really well informed on it being holistic and not just what's going on biologically, but also what's going on internally, what's going on in your environment. And one of the reasons why we do what we do at U Medics and why we thought it was so important is because we were noticing that these tragedies were happening. These, our peers, Black people, were getting shot, and the people in the community were throwing their hands up and not knowing what to do, and expecting the paramedics to be there on time, expecting the police to do something, to use their first aid kit or whatever, or expecting there to be someone else around, and then when their loved one is struck by violence, having nothing to do, and a lot of times not having anything to do and not knowing what to do, because an experience like a gunshot wound especially is so traumatic. What do? We pull our phone out and record, we get on Facebook Live, or we, use that to affirm a narrative that Black people aren't worth anything and Black people are all violent. And we use examples, you know what I'm saying, to contribute to a negative stigma in our community, when we wanted to say, hey, this is the situation, but we can still respond to it and reaffirm and reestablish community and accountability in the moment, not so much, you know what I'm saying? And I think staying in our lane has been a difficult thing, because especially in gun violence, we want to be on the prevention. We don't want, in a perfect world, we wouldn't need to teach any workshop, because people wouldn't be getting shot and people would be able to depend on an ambulance being there and 5 to 10 minutes. But unfortunately, we know that ambulance times disproportionately don't meet that national requirement in communities of color. So that's what we know. So our question was, okay, what can we teach people how to do? What quick, easy to comprehend things can people learn how to do to maximize in that 20, 30 minutes of waiting around? You know what I'm saying? And through that, it's been a really, really wild roller coaster, even to just training so many different things. I've been able to travel and train in Washington, D.C. We've done trainings in New Orleans and New York and all types of different places. So that's definitely a privilege, and to learn about the dynamics of other places across the country. So yeah, I mean, I think I'm really excited to be here. And like I said, holistic health is something we value a lot at Ujimaa Medics. And most recently, with all the protests happening all over the country, we've excuse me, we have, constructed our own street medic curriculum. So we just finished that out and graduated our first class of street medics, which I was happy to be a part of. So we're building and trying to respond to everything that is going on, but still staying in our niche of training and educating from that lens of collective work and responsibility.
Journey, thank you
so much.
And thank you, Rachel, as well. That was so empowering. Journey, I know you have a special story to tell about how your training has been utilized. So if you could just share that briefly, that would be amazing.
Before
community pharmacy.
Yeah,
also because she's having a Wi-Fi problem, so we was
yeah. I don't know what is going on. There's trees falling down, so that's why I keep turning my camera off, because I keep going outside to see what is going on. So yeah, and this is I will definitely share this story, but I'll try to keep it as succinct as possible, because I can do it in a really, really detailed, elaborate way. And if you want to hear that version, I will encourage you to Google it, actually, because there's a recording via The Moth that I think is really, really good. That's been practiced and is more, like I said, detailed, more polished than what I'll probably say right now. But yeah, I mean, I had just became a member of Medics maybe 5 or 6 months ago at this point. It was July, a few days after I turned 15, I think, or 16. I don't know, my timeline is off. I think I had to have been turning 15. I was 15, so I actually misspoke. So I became a member of Ujimaa Medics when I was 14, not 15. Excuse me. And I had only done one training. I've been a member for kind of a few months, but you build on and you do trainings and you practice. So I'd only done one training when one day I'm coming home on a regular Saturday afternoon, middle of the day, and I am in my apartment, I'm home alone, and I hear gunshots like crazy. And I've heard gunshots before, but these were ridiculously close. So I'm wanting to know, I know I have some information about how to respond to people who have been wounded, but I want to obviously be safe, put myself first. I'm not going to run into gunfire, because that's rule number one of any street medicine you'll learn is seeing safety, So I'm let me stay inside. And I look and I can kind of see people running across from the gas station, which is where the shooting took place. I'm just kind of trying to scope it out. I definitely wasn't gonna leave my apartment and go outside of the gas station, but just kind of like a miraculous kind of thing, I just so happened to leave my back door unlocked. And a gunshot wound victim opened my back door and ran inside my house asking me for help, looking for shelter from the shooter, from the active shooter, and also trying to get help because he had been shot in the neck. And so I was very frazzled and I was very scared, but I was very grateful that I had the training that I had via Ujimaa Medics. And of course, everything wasn't perfect. You know, I forgot to use gloves, you know, just kind of like a thing in the heat of the moment, but I was able to apply pressure and do an occlusive dressing in his chest, you know what I'm saying, to, you know, prevent the bleeding and things like that. And it was a really bad wound. It was through his neck and up through his jaw. So it was like it was just a messy situation. And my mom came, you know, she came home about 10, 15 minutes later, and she was able to kind of do crowd control and keep everything calm. So that way I could attend to him and give all my attention to him. And, you know, the police came and they were problematic in many ways. The ambulance paramedics came and they were problematic in many ways, in my opinion. But at the end, you know, he was able to survive. I'm not going to, I mean, you could definitely find out his name, but for just today's purposes, you know, he was able to make a full recovery, and in a few weeks, we actually trained his entire family in our gunshot wound training, because they were a family who was no stranger to gun violence specifically. They had lost people to gun violence. I think they had lost like 3 of their family members like 2 months prior in May. So we were able to train their whole family. I think there was like toddlers there who were like 3, and the great grandmother was there. She was like 80 something, but we trained their whole entire family on the same training that I got, that I was able to save his life with, I guess you could say. So yeah, that kind of just came full circle, and it was a really great experience to see accountability and see community care happen in real time, and less of a theory, and it actually be a real thing. So, and it also made for a great college essay. So, you know, it wasn't just, I did get something from it. I got a lot of experience, and so yeah. And if you guys, like I said, they dropped the recording. So you guys should go watch that if you're interested, because that is way more detailed than what I just said.
Thank you so much, Journey. It's so crazy that at that age, you have to think about people in your community dying from gunshots. And the fact that you hear every day, it just ends up being a normal thing. And Izzy and Brendan, if you don't mind introducing what you guys do at community pharmacy, how that developed and how you got introduced to community health, because you guys have been around for a really long time.
Yeah, absolutely. So, I mean, first, I just want to say thank you to both Rachel and Journey for sharing your stories and how you guys came to be and what you've done. It's amazing work, and we stand so tightly in solidarity with you guys. And thank you so much for being out there and doing this. But so a brief history for us. So we've been around for a while, actually way before me and Brendan's time. So I'll try to do justice to it. But we started in fall of 1972. We were a student-run community pharmacy, so it was just a pharmacy when it started, and it was entirely owned and run by students. We've never had a boss. We've never had a hierarchical system. We've never had an owner. It started that way, and it's stayed that way. So at first we started in a little back alley in Madison, Wisconsin, giving basically pharmaceuticals and drugs to students for the best price, the most accessible, kind of going against big pharma at the time. In the midst of 1970s Madison, which was really when labor was so critical, organizing was so critical, and it was a big time of growth for activism and organizing in Madison. And then in the 80s, we moved to the downtown location that we're in right now. And when we did that, we expanded our whole business. So we still have a pharmacy, but we do much more with supplements, with tinctures, with herbal remedies, with homeopathics, with flower essences, with health and beauty. We have a ton of stuff for that as well. And then also just basic medical supplies. And so we have like hugely expanded what we were offering. And then basically since then, how we kind of changed was we were also less directed toward the student population. So at the time, the student population was really like this radical organizing group. And since then, that organization has dispersed among other communities in Madison. And so we did as well to like better serve those communities. And so we are not student run anymore. We're just run by locals as a cooperative. And basically, community pharmacy has been through a lot of crises in Madison and just in the world in general. And so when COVID happened and when the protests happened, we had to do some adjustments, but it was nothing that we hadn't done before in our history. So in the 1990s, we provided a ton of support for AIDS and HIV people in our LGBTQ communities. We were giving herbs out then and trying to help people get through those symptoms and those hard times. We also, in the 2000s, 2010s, we saw the Scott Walker protests in Madison and the occupation, and we've joined many protests and helped provide medical supplies in those. And so that's basically our history. Do you want to talk about where we are now?
Sure. Hi, I'm Brendan again. So I'll just say a little bit about our structure and how we run. So Izzy mentioned that we are a cooperatively run business. So we have a team management structure, and then those teams make decisions within themselves and then bring that out to the wider store, and that's sort of how we set our direction and make a lot of collective decisions that way. I think a kind of core driving motivation of this place is to offer healthcare alternatives. And as you mentioned, a lot of our history, I think especially back in the 70s when this place first started, like alternative healthcare, access to herbs, access to even like supplements, I think was a really, really foreign thing to a lot of people. So a lot of like some of the first pharmacists, including somebody named Peter, was out of their own personal interest, like brought that to this place, and that has really kind of become a lot of who we are. How do I say this? You know, one of my coworkers, Michelle, who's worked here for 30 years, talks about. I just feel like we have we have an ethos of care, and we really try to show up for people who come in. A lot of people come in like struggling with like more chronic conditions, and just a lot of folks who like fall through the cracks of the medical system. And we really work to provide resources, access to herbs, and people, just providing resources for people to like work through their health problems, and find care in places where they may not have.
And so then as a part of those things, so we've kind of tried to do this blending as well of our pharmacy and our herb departments, because even though they're separate, we try to like have them work closely together. So part of that is, you know, a lot of folks might be chronically ill and have to take a prescription medication as a part of their lives, and we always cross-check that with all of the herbs and alternatives that we can offer for some of the side effects that those can have. We also have a needle program where we sell packs of needles for $1 and we take sharps. We do Narcan trainings with all of our staff, so we're all prepared for those sorts of things. A lot of us go to street medic trainings because when protests happen, we are people who are expected to turn out to those and represent. And so those are some other ways in which we've now kind of expanded what we offer to our communities. A lot of the folks in like the downtown location struggle with homelessness and houselessness, and money is really tight. And so we try to offer whatever we can for either free or very cheap to those people, and make sure that they're taken care of first. Then also just a part of our cooperative structure and like our outreach is we get to choose who we take care of and where we show up. And what we've, you know, decided is that we want those to be like the most marginalized communities, the communities that are most in need. And we want to really like take our privilege of being a business, and specifically a mostly white business, and give those resources to people. And so, you know, part of that's been with COVID. There's a lot of folks who don't have access or don't feel safe going to doctors' offices, but like are getting sick. And we've come up with protocols. I thought of, Rachel, what you mentioned. I wanted us to share protocols to see what we were giving people. But we've come up with like herbs that we're recommending to people, and seeing how those play out, seeing how we can better provide for those communities. And then with all of the protests, you know, being in Madison, when the protests happened in Minneapolis, we were so close to that. And so, you know, some of our workers went there and brought supplies and made sure people were safe and they were okay. And then as soon as Madison started, we were out there giving med supplies. We used our space as a place where street medics could check in and like divvy up their work. We went out with street medics. We gave as many masks as we could to as many people out in the protests as we could. And we just got really creative with how we were gonna help. And then after our protests waned down a little bit, we started thinking about ways that we've also financially helped groups. So through all of various like activism movements and protests and points of stress in our communities, we've always tried to give back to our communities. And most recently, that's been with our local bail fund. If you don't know, Madison has a bail fund. It's called Free the 350, and it specifically bails out Black and brown folks from our local jail. And so we decided to raise money on Juneteenth for our bail fund, and we're actually able to use that money to bail out a couple people, which was really amazing. And it's work that we want to continue to do, especially using like our platform as a retail business and our platform as a cooperative to reallocate our money and resources where they're needed most. So yeah.
Wow, so amazing. Like we're at a loss for words. And I'm so appreciative that you're using your platform as a business that's been around for so long to give back to the community. Like you're not just doing it to profit yourselves or the pharmaceutical community, but you're mixing pharmaceuticals with herbalism and giving people alternative tools. So cool.
We love to see it.
Thank you for sharing. And we want to know, what are some of your difficulties in competing with the traditional healthcare system? And we can start with you again, Rachel.
Also, I wanted to add like perceptions that you're receiving from people in terms of like, are they like, this isn't, I don't trust this? Like, how do you develop trust within the community with the services that you're offering? Okay, yes.
Great question. I started laughing when you were like, what are the troubles you're having with the industrialized healthcare system? Like everything. Yeah, everything. Well, first off, before I like fully answer that, I just wanted to shout out to Sarah Lynn and Michelle, and thank you both for bringing disability justice into the conversation. As a community herbalist who is also chronically ill and disabled, it's really important to bring that into the conversation, because I think when we're talking about health autonomy, we're not just talking about people having access to free healthcare. I mean, that's important. Like, of course, that's important. We have to unshackle healthcare from profit. That's what we're talking about in this space. But we also have to redefine all of it, because our healthcare system is also racist. Our healthcare system is also ableist. We're built on this idea that you're fixed or you're broken. And being broken is really bad, and we all want to be fixed. And fixed is this very narrowly defined idea of what it means to be this, I don't know, white, neurotypical, like heterosexual male, whatever those definitions are around. And so I think like health autonomy is so much more than just having access. It's very much about people getting to define what wellness is for their own body, that we all have that right. It's about building these resilient networks of care where nobody gets left behind, and care being something that we get to define what that looks like too. So I think, I mean, part of what we're up against, and I don't actually know if this is true, I need to check the legalities on this, but I think up until at least a couple of years ago, if not still today, I think it's technically still illegal to call yourself an herbalist in Tennessee and South Carolina. I should double check on that. But well, I mean, so we're up against that. Like, we're up against the medical industrial complex disregarding other forms of healing in our community. We're certainly up against that. I think, like, as a community apothecary, that's not something that we've had to deal with in our community. I think a lot of people are really open to working with, like Izzy and Brendan were saying, you know, working with complementary modalities. We certainly aren't going around telling people that all they need to do is, you know, take this one herb or get some sunlight and they're going to be fine. I mean, that's something, I would say that's something that we've been up against as herbalists in our community. Is we have I've seen a lot of alternative practitioners saying a lot of ableist and privileged things during this pandemic. I'm sure y'all have seen that in your own community too, where we've had a lot of mostly white alternative practitioners telling people that COVID-19 is not real, or that they don't need to wear masks and they just need to get a lot of vitamin D and eat a good diet and they're going to be fine. And if they get sick, it's a personal failing. And so we've like had that narrative I've seen in our community, and that's something that we've bumped up against and definitely had to push back against with folks. But, you know, I think in general, I think in general, just to speak back to like what Izzy and Brendan were saying, I mean, my vision for what I want for all of our communities is I want a healthcare system that's worker owned, that's integrative, right? That has cardiologists working next to acupuncturists and herbalists, that like where we can have all of that community run. So yeah, I'm trying to think of what else to say. I mean, all of the challenges of working against that machine, our healthcare machine, are real in our community. And I think the other biggest thing that we're working with just in East Tennessee and in the South in general is we still have a lot of people that don't believe that this virus is real. And so in our community, the virus is running rampant right now. Nothing has been closed down. They're trying to open school up. A lot of people aren't wearing masks or following social distancing protocols. And so, you know, we're feeling challenged just trying to like meet the demand that we're already seeing and knowing that it's probably not going to get better anytime soon. So just trying our best to get as much medicine as we can made, and just be trying to equip our people with the skills that they need to take care of themselves and their community. So I'll stop there.
I definitely have experience with distrust, just kind of off the strength alone that our trainings are not backed up by an institution of like American Red Cross or, you know, some sort of hospital, or have some big funding behind our name. So I think a lot of times that can cause some like distrust, because what a lot of people fail to realize is that in the grand scheme of the planet and human activity on the planet, institutions have been around for not that long, and we've been taking care of each other for the entire time. And I think sometimes people just don't realize that. And, you know, there's a lot of, you know, there's a lot of systems that have showed us that we cannot trust Black people, and we can't trust the words that come out of our mouth, and that we're not valuable, we're not credible. And that happens on a large scale, but also within the community, and within these communities of colors just automatically don't listen, don't want to hear what we have to say. And I think, you know, we're never going to be anywhere we don't want to be. We're never going to force anything down anyone's throat, but I think we also try to approach everything with compassion and know that we've all been to some extent conditioned to perpetuate these systems in our own way. Like, nobody is perfect, and I can even think of examples in myself where I perpetuate, you know, anti-Black systems, you know what I'm saying, towards myself. So I can't really I just have to have patience and compassion when I'm dealing with that, because I know that there's so much to unlearn from a really, really broad perspective. And especially when we're thinking about community health, putting the members of, giving the mic to the people in that community and letting them write the dose and letting them write the treatment plan for themselves, I think is something new that a lot of people don't have experience doing. And so I think through that, the biggest takeaway is just to be patient and be compassionate, because everybody is trying to dismantle not only systems externally, but systems internally of all type of stuff. So yeah, that's all I really have to say about that.
Cool. Okay. Brendan, do you want to go?
Sure. Logo, you have call 911.
Sorry, we're in our store. So sometimes there's a phone that talks. So we're wearing masks.
Yeah, so as far as interfacing and working with the medical community, we've existed so long as a business here. I think we have kind of put ourselves in a position of acting as a bridge between more traditional medical communities and herbalists and more holistic or integrative practitioners. I think especially having a pharmacy helps with that, because like we have somebody who can kind of be made sense of by the medical community, and that it's I think that's often helpful for us. And Izzy again mentioned the like interaction checking and finding ways to have people be like very well informed about the prescriptions they're taking and how they might interact with herbs. We have kind of a referral network of physicians who we know and trust, and have a lot of us who have had our own health problems have worked with in a lot of capacities. So we have information that we're able to give people about like where you can go to work with somebody. We are also working on a more updated and complete like shareable resource to give to folks, especially unhoused folks and marginalized communities. So we're hoping to have that up soon. Another very exciting topic that everybody loves to talk about is pharmacy reimbursements and how that affects us in like a really weird way. And that wasn't something I really saw until I started working here for a longer time. But over the years, it's become a lot harder for independent pharmacies to exist, just because the kind of cutthroat world of pharmaceutical reimbursements just makes it really, really hard to actually make any margin of profit on these things. I could talk for a while, but there's all these weird, complex ways that these companies kind of squeeze all of the profit out of this. And if you're not working in a big conglomerate, it's really hard to run a business in that way. So that's one frustrating thing about interfacing with that world.
Yeah, and another aspect of that too is because we're a supplement shop as well, and now supplements have become such, and especially vitamins have become such a thing. We come into a problem of people buying, random vitamins at Target or Walmart and taking them and then coming to us and being like, this didn't work, I didn't like this, this made my stomach super upset. And we have to kind of be those folks to also help guide like what supplements are actually like safe and healthy and good for you to take, that are closer to nature, that are closer to what those herbs were like meant to be doing. And so that's another hard part that like we as just like a small business have to deal with, especially right now. But then ways that we've been building trust is one thing that we've always stressed is that we always have Spanish speakers in our business, and we translate as much as we possibly can into Spanish. We have a huge Spanish-speaking population in Madison that goes unnoticed and often does not have access to traditional medicine. And so we try to act as people who can both like speak with them and also just like give them herbs that would maybe help them in ways that they will never have access to through the medical system. We also do a lot with mediating symptoms. So, as like Rachel was saying, there are people who are chronically ill who just have illnesses where like saying take an herb and like get some sunshine is not going to solve it. They need certain medications to survive and to keep living. And that's absolutely fair and fine. But the problem with prescriptions is they will always have side effects that no one cares about in the medical industry. And another huge thing with us has been trying to, you know, take folks who are chronically ill and say like, no, we can't give you a vitamin that's going to solve this illness, but we can try to offer supplements that will help you and mediate those symptoms that you're having from these medications and from your own illnesses to make you feel like you can actually like exist and continue to like be a person here. Another thing that we've just like had trouble with recently is, given all of the protests, it's been really hard being in Madison, and I'm sure all of you have experienced this where you are, because policing has increased. And as a pharmacy, we have to be basically like up for the police. Like the police can come in and suss us out whenever they want because we are a pharmacy. And so that's something that we've struggled with as well, is we have communities that are marginalized and that like do not want to interact with the police, do not want to interface with the police, and come to our location as a place that's safe. And we have to kind of be those in-between people where like we try to keep our community safe and keep the police out. But we still have to have this kind of public facing, like, we're just a business mentality. And so that's a hard in-between space that we try to take. But I think given our history, we're just known as a point of safety for our community. And we've built that through so many people doing so much good work that we will always continue to fight for our community over like any sort of like policing or big business. And that's where we've been building trust the most. Yeah, I'll pass it back to you guys.
Thank you all so much for sharing that. It's crazy that we have to convince people in our community to trust people in the community that are really trying to help them. And really, we need to figure out a way to, I don't know, I guess, take authority away from just the doctors and start building trust in our communities through giving people alternative resources and showing that this doesn't have to be a utopian thing, that it's not just for hippies that are looking for other ways to live, but that really it's the way we need to live in order to live optimally. So Rachel, you touched on this, but if anyone else wants to chime in on what you see the future of community healthcare. So Rachel, did you want to add anything to that? You don't have to. We can pass it to Journey.
I want Journey to just speak more. I like want all and Izzy and Brendan. Like let's let
I'm gonna keep it short. I think a future of healthcare for me looks a lot like kind of what I said earlier, just putting the responsibility and the power in the person who is being treated, you know, because that just, you know, like psychologically, that just does so much more for your body. And I think there's like a lot of connection mentally that a lot of people forget to factor in, that that a lot of people just forget to consider, which is really a really important thing. You know what I'm saying? I want people to feel safe. And safety is not something that can be contained in one thing. It's something that has to be modeled. It's a lifestyle that really has to be a 360 flip. I think capitalism drives a lot of inequality in the healthcare system that really, just from my perspective, until we tackle that, it's just really impossible to even consider a different system, because the lobbyists, the pharmaceutical lobbyists, for example, they're the people who are profiting off of poor treatment plans, really, when you think about it. You know, and I understand, you know, I'm not opposed or against taking medicine. You know, like, I'm not opposed to taking pharmaceutical, I'm not opposed to that, because I definitely understand that in certain cases that is necessary. But I think that when that's the only treatment plan presented and you're not learning about herbalism and you're not learning about other meditation, for example, you know, like something so simple, when that's not even infiltrated into the system that you're using to care of people, it's very clear who it's in the interest of, because it's not in the interest of the patient, it's in the interest of the people who are writing the check and cashing the check, more importantly. So that's really, like, sometimes that question is so hard for me to even tackle. And that's why I'm so glad that I work on a grassroots level, because I can really just kind of make a difference in this one, you know, community, in this one city that I'm trying to reach, and things like that. Because from a systemic point of view, I can't really, a lot of these systems, racism, I can't even really fully wrap my head around eradicating, with capitalism still at the foundation of this country. So that's really all I have to say about that. But yeah.
Really quickly, can I answer this question as well? I know I'm not part of the Geo Collective. My name is Makini. When I think about personal health care, for me, it means knowing my body and understanding what my body needs. And I think a lot of the times we put a lot of trust in the medical healthcare professionals. I think Issy, is that how I don't want to missay your name, but I think that you were talking about putting, it was a trust, putting your trust into doctors, and Ebony had touched on it too. And I think, like even Journey said, you know, we don't, neither of us win when trying to completely separate ourselves from like the knowledge that we all have. But I think personal health care, at least for me, would be listening to me, myself, knowing what I need, and then being able to continuously investigate what works personally for my body and my mind. And so I just wanted to answer that question. Thank you guys for asking, and thank you for this space.
Thank you so much, Makini. So before, if anyone else would like to share, we just want to hear from Izzy and Brendan. And then if anyone has any pressing desire to share, then you can.
Yeah, sure. I can just start, and Brendan's gonna hop in again. But I think a part of like our philosophy being a cooperative, and then part of like what we're continuing to fight for and looking to the future, is really that like as a cooperative, part of our base is that we are trying to fight capitalism in any way we possibly can. And something that we really understand from the base is that capitalism and systematic racism are like right here with each other. And that is like one of our major ways that we are trying to fight, you know, both racism and capitalism, is trying to use our resources and use our like not hierarchical, not like retail-based, not profit-based mantra, but our cooperative mantra to better benefit the people and really like fight for our communities and try to give them the resources that we can. And so that's a base of where we're looking. Do you want to, Brendan wants to talk a little bit about COVID stuff too?
Yeah, I guess I'll start with sharing just a tiny bit of my personal history. I have in my own health journey, I've struggled with some chronic illnesses, including what was most likely Lyme disease. And that basically I kind of reached the end of the road as to what the kind of traditional medical world could offer me in terms of essentially just antibiotics, and I still felt awful, right? So I just kind of felt like I ran out of options. And actually, that's actually when I first started coming in community pharmacy, like chatting with folks here and people who know a lot about herbalism. I just kind of started picking things up. And it wasn't like I was cured overnight, but it was this kind of a long, like piecemeal assembly of just things that worked and like things that could help. So I feel like I'm really glad we can like continue to offer that, and just really I feel for people who run out of options in terms of what they can be offered. And I worry about, I've been reading stories of COVID turning into a more chronic condition, and people who have been struggling for months with these long-term symptoms. And I actually just read an article like talking about the overlap between the Lyme disease community and chronic COVID communities, and just in the way that people aren't believed, there's no treatments, and people just really get dropped. And that's worrying for me. So I'm hoping that in our evolution, like as we kind of learn more about this and as we gather resources, we can continue to give people that and kind of weave a net so that not so many people fall through the cracks. And then another part of the way I see the future of this place is continuing to make things accessible. I think obviously wealth inequality is staggeringly awful, and I think as more technologies around like life extension and as these like really commoditized and monetized things, like not to like I guess to drag Goop a little bit, but like these like really commercialized healthcare things take off. I hope that we can continue the ethos of making things accessible and making things options for folks.
Yeah. Thanks to everyone who spoke today. We really appreciate all of you, and thanks for hosting this, everyone at GEO. You guys are amazing.
Thank you for sharing. So we have someone, Martha Benavides, that wanted to share what she hopes community health will look like in the future. So you can go ahead, Martha, and unmute yourself.
Hi, I won't be too long because I have to enter into another process, but I'm glad that you are doing that work in the US. It's very, very urgent and important. I am working with social movements in Central America and worldwide, and we are concerned that this situation with the pandemic is being used to create situations in many countries, including in your country, to change rights, political, social, economic rights. This is happening at least in some of the countries in Latin America, and people are being ostracized and being put in jail if they go out from their homes. Also, the governments are taking big loans that then they use to supposedly give support to people that are being forced to stay at home. It is not that we don't understand that given the conditions of this illness, you don't have to take those those measures. The thing is that what they are being used for, and the problem is that as these situations happen, in the community of nations, many countries are going to go through political changes, and the representatives that are going to be in the World Health Organization or any other places are going to be people that are not really talking about what you're talking. That's one thing. The other thing is that, any virus can become a pandemic if this happens in places where there is malnutrition, hunger, poverty, environmental situations that are not taking care of the planet, where there is conditions of climate change. And so all these problems are going to continue to happen because we are not taking care of the planet, we are not taking care of the environment, we are not taking care of nature. A lot of you are talking about herbalists and all that, and that is very important. At the same time, in our cases, we have to make sure that we impact on the policies and politics from the local to the national to the sub-regional, regional, and global level, because otherwise we do all this work, but then the people that then take control of situations such as these ones change a lot of the policies and politics, and then they create a different world order. As a result of this pandemic, what's going to happen is that more and more nations, like say in Asia and in Africa and in the Caribbean and in what now is called Latin America, are going to have administration of government, because they are administration of governments that take power and really make difficult situations for communities such as yours or groups such as yours. Right now, people in Bolivia are in the streets demanding the respect for the rights of indigenous peoples that are being repressed. And then, they were supposed to have elections, presidential elections, and there is kind of coup d'etats going on. So I just thought that I wanted to talk a little bit with you so that you pay attention to this larger picture, because that's going to affect the local stuff that you're doing that is very, very important. Really, what you're talking about is being healthy and not so much about medicine, but health. Because medicine, you have to wait until you get the illness and then, find how to cure it. In reality, one of the major things that we have to learn from the First Nations in the world, and especially in our countries, we are working to recuperate and to restore the traditional knowledge and wisdom of the indigenous nations that work very much about prevention, so that we have to do less on healing, because the medicine and the way we live is our health. And so we know that more pandemics, more problems such as the viruses are coming because the conditions are not creating to live in health, but really it's like living in hell. So at this point, I just wanted to congratulate you and make sure we are happy that you're doing that. Make sure that you do that kind of work on keeping healthy, but in order to keep healthy, people have to be nourished well. In all of Latin America, there is going to be many, many millions of people that are going to go into poverty and also facing severe hunger right now. So the policies of your country affect not only you and in the aspects that you've been talking about, but affect the whole world. And the kind of world that is being shaped is one that depends very much on medicine instead of health. And so keeping the planet and nature and the environment well, the oceans, is as key as keeping ourselves well. So that's all I wanted to tell you and congratulate you. And I am very happy that you're doing all that work. We are doing our part, and we are trying to make sure that these coup d'etats by authoritarian regimes don't happen, so that the whole world is being able to live in peace within people, the families, the communities, and nationwide, and with the community of nations. So take care, and thank you very much. Be well.
Martha, thank you so much for sharing that. It was really beautiful. And yeah, there's always a wide lens on the US, and what we adopt, we really set the stage for the rest of the world. So we need to implement more of a holistic framework into how we practice our lifestyles in general. Like, medicine that is prescribed to you is usually just for a symptom and not the root cause. So we really have to get to the root. And Audra actually mentioned something that's a really good idea, is to honor Indigenous people and elders and our ancestors, and putting out what type of medicine they use in their daily lives. So that would be an excellent resource guide. And we did have a question from Oscar. He said, are community health workers integrated into supporting herbalism and alternative medicine programs? If yes, how does that look within a community? So any of the panelists want to chime in on that, you can unmute yourself.
Sure, we can talk about it a little bit. Did you want to?
Yeah, I mean, just super briefly, we do, over the years, we have kind of built some relationships, or at least a reputation with doctors and other healthcare practitioners in the community. So often we get folks sending, like if a practitioner is like unfamiliar with an herb or doesn't quite know about a supplement, they'll send somebody here or give us a call and just ask about that. So yeah, that's one small way that we can connect there.
Yeah, and I think like the thing too with us is we try to stress, we try to find like our webs in the community of like who can shout us out and who wants to as well. Obviously, we know not all doctors are, or not all healthcare workers are really for herbalism. And you know, that's their thing, that's their prerogative, but that's not where we are. And so we try to find those folks and educate those health workers and folks that we have connection to, and then really strengthen those connections. So if people are in the medical care system and they are a healthcare worker, we really want them to shout us out, and we really want to work with them because we want to provide that for people. And so we just try to use access to that as much as we possibly can, wherever we can. And that's kind of where we interface with it.
Yeah, I can just respond briefly. I would say like in our community, just like where we are in East Tennessee, unfortunately not. There's not a lot of that work happening and collaboration happening in any sort of like formal way. Although it's funny, like I said, I've been in my community as an herbalist for over 8 years now. And I have like through my herb business, not through the community apothecary, but through my herb business, sold medicine to tons of doctors and nurses. I have quite a few healthcare workers who are clients of mine who are really excited about using integrative approaches to medicine, but are not really allowed to talk about that with their patients and are not really allowed to integrate it into their work in a formal and in their formal institutions and that sort of thing. And I think I'm definitely seeing that integration happening in some communities and in some bigger cities, but it's not really something that we're seeing here locally.
Thank you all for sharing. And it doesn't look like we have any more questions. So if the participants just want to give a last line or word to close the webinar, we'll end a little bit early. Rachel, you're up.
Keep making me go first. I just have a lot of gratitude for all of the wisdom and brilliance that's in this Zoom room, all of the folks who did not really have a chance to speak, but maybe through the chat, and just want to honor all of y'all's brilliance and all of the work that each and every one of you are doing in your own communities. It's inspiring to get to be in spaces like this. I think we all need it because we know how exhausting it can be to just be in our own little realms and our own communities doing this work. So y'all are medicine for me today, just getting to be in this space and hearing and seeing what you're doing. So yeah, we got a lot of work to do. But as I think we're realizing in this pandemic and this moment of like unraveling, where all of these systems are being laid bare and how not sustainable they are and how not life promoting they are, you know, like now is the time where the only thing that really does matter is community care. And like, that's all there is how we care for one another. Like that's the work that there is to do moving forward. And I'm excited to do that with all of my people and with all of y'all too. So lots of gratitude.
Also feeling a lot of gratitude, really happy to be here, really glad that I was able to be on this panel with such amazing people. Just for follow-up, if you're interested in Ujimaa Medics, you can check out our website, which is umedics.org, umedics.org. And there, you know, you can find out a lot of different information. You can also request a workshop. Our process on workshops has changed a little bit amongst COVID. Like I said, I know these are people from all over the country, and usually we would be open to traveling, but I think with everything, Chicago isn't a hot spot, but other places are, so we probably won't be traveling, but we could perhaps do like a webinar like this and do our training virtually, which we have done a few times so far. But definitely if you're in the Chicago area, we are starting to do in-person trainings outside, not in any enclosed space, but in a community garden space type of situation. So if you're open to that and you're in the Chicagoland area, you can definitely hit our website up. So yeah, I'm just really grateful, and yeah.
Yeah, we just want to say we're so grateful and so thankful for everyone we've been able to be on a panel with. Journey, we will absolutely be hitting you up. We are in the Chicago area. We're coming and we're getting trained. And we're very excited about it. But yeah, we're just so thankful to be on this panel and to meet all of you guys and just keep strengthening those bonds. I think it's great that we can all talk to each other and like be in communication even during this very stressful time. And I just like am really happy to be here and to be able to do that with all of you.
Thank you all so much. Like, my heart is filled with so much gratitude. Yeah. This was better than I could have imagined, really. Building connections between the panelists and international connections. It's amazing what a handful of people can do to really influence the collectives in general. So thank you for all the amazing work that you are doing. And
you can look out for our issue that's coming out with a broader scope about how to build collectively with mental health and the health that we're talking about on this panel on August 17th on geo.coop. All the people that are registered for the webinar, which is all of you guys, will get an email with this recording and all of the panelists' websites and social media if you guys want to connect. And I think that's all. That's everything.
Yeah, that's it.
Thank you guys so much.
Enjoy the rest of your evening.
Yes.
Lots of love.
Yes. Okay, bye. Do we end?